Dear students, very good morning. Let us start with the ENT segment. I tried my best to give you all the important topics for the upcoming examination. Which of the following is not a indication of auditory brainstem response beta? If I take the level of the last FMG examination, because they have asked you a lot about rehabilitation. They ask you a lot about hearing aid or cochlear implant or brainstem implant. So just remember this point. Okay, if there is a neural deafness, I will be going for auditory brainstem response. If there is a neural deafness, we'll go for auditory brainstem response. Neurofibromatosis, yes, we will go for auditory brainstem response. Congenital absence of 8 nerve. If 8 nerve is absent, I have to stimulate the next level. I will be using brainstem implant. Mesial aplasia, cochlea is absent. It is a contraindication of cochlear implant. I have to use brainstem implant, and which is not a indication. Mondini. So Mondini is a sensory deafness. It is a 1.5 turn, so it will be not a contraindication. Am I understandable? It is not an indication, it is contraindication. What is the indication of this cochlear implant? What is the other way to complete attempt this question now? Now some students say, sir, I am not confident about indication of brainstem implant. So beta, common sense. Mondini dysplasia, I have taught you in the lecture, Mondini dysplasia is a most common indication of cochlear implant. I am confident you are aware of this statement, so I can't use in here brainstem implant in Mondini dysplasia. Coming to the next one, all of the following statements are true about retropharyngeal abscess. Abscess of the pharynx, very important topic, beta. Either they will give you something on retropharyngeal abscess or they will give you something on parapharyngeal abscess. MCQ will be there. Examination of pharynx show a midline bulge. The first statement seems to be true statement. Let us read the other option. Mostly present at pediatric emergency, absolutely true. X-ray show widening of the prevertebral shadow, very true. Retropharyngeal abscess extend from the base of skull to the bifurcation of trachea, very true. I want to give you one important concept. Parapharyngeal abscess extend up to hyoid bone. Retropharyngeal abscess extend up to bifurcation of trachea, true statement. Option A, examination is showing a midline bulge, not at all. If it is a midline bulge or there is a swelling on both sides of the midline, it is your prevertebral abscess. Retro is localized. Why? Can we learn? Can we learn the nice anatomy? This is vertebral, this is prevertebral fascia, this is retropharyngeal. In this area, there is a midline fibrous tissue. This fibrous tissue divide your retropharyngeal space into right and left bit. This is my retropharyngeal space. This is my prevertebral space. This is my posterior pharyngeal wall. I hope you're getting my message. So if there is a abscess in this area, it will be on one side of midline, not on both sides of the midline. So this is a false statement. Now, one more MCQ, one more important concept about the treatment. Treatment of any abscess is IND, incision and drainage. But beta, make a rule. In retropharyngeal abscess, we go along posterior surface of sternocleidomastoid, and if it is parapharyngeal abscess, it is along anterior surface of sternocleidomastoid. Let us revise two important points. Retropharyngeal abscess extend up to bifurcation of trachea. Parapharyngeal abscess extend up to hyoid bone, is extending up to hyoid bone. Retropharyngeal abscess is along IND, along posterior surface, para anterior. Para, there will be a swelling in the neck. Retro, there will be localized swelling on one side of the midline. Done. So question number 2 is clear. Question number 3. 30-year-old female with family history, mother side, pregnancy, hearing loss, bilateral, slowly progressive. What is the motive of giving this MCQ? Motive of giving this MCQ is to make you confident of all the feature of otosclerosis. There is some notch at 2000 Hz, but we call it as, we use a word Carhart notch. Diagnosis going for otosclerosis. I will use this MCQ. What are the treatment of choice? So stepidotomy better than stapedectomy. Better than stapedectomy. What is the drug of choice? Drug of choice is sodium fluoride NAF. So beta, if there is any contraindication in the examination, if they give any contraindication of surgery like inflamed foot plate, we'll go for sodium fluoride. What is the mechanism of action of sodium fluoride? Always remember, it increase osteoblast, it increase osteoblast, decrease osteoclast, increase osteoblast, decrease osteoclast. Done. Is this clear? Coming to the next one, a case of carcinoma larynx, involvement of left vocal cord, left epiglottic fold, left ventricular band into paraglottic space. Paraglottic space, what we have learned in the lectures, you tell me, in the classroom, on the online platform, what we have learned, what are the important indication for T3, what are the important things which make T3? 5 P's, you remember? Paraglottic space, pre-epiglottic space, paralysis of the vocal cord, perichondritis, pharynx. So if there is a paraglottic space involvement, it means tumor have come out of the larynx. So I will go for T3. Or even if it is T4, what is the treatment? Always remember, it is a treatment is total laryngectomy followed by radiotherapy. So right answer will be in this MCQ will be your D option. Now I will try my best to give you ultra concise concept. T1 is only one subunit. T2 is 2 or 3 subunits, and in these both the cases treatment is radiotherapy or partial laryngectomy. And if examiner give you T3, T4, what is T3, T4? Paraglottic space, pre-epiglottic space, pharynx, paralysis, perichondritis, or T4. What is T4? Carotid artery involvement, chest involvement. The tumor is going very away, pre-vertebral space, tumor is entering. We will go for total laryngectomy plus radiotherapy, plus we can try chemotherapy. But if the patient deny, important MCQ for your FMG examination, just remember, if the patient deny what is the other option? We can go for concurrent chemoradiation, but a patient is not interested for surgery. So what is the option left? Option left is radiotherapy plus chemotherapy. So we go for concurrent chemoradiation. Concurrent chemoradiation. Done. Is this concept clear? Coming to the next one. All of the following statement, all of the following are the feature of atrophic rhinitis. Very important topic. Either they will ask you hypertrophic rhinitis, that is your mulberry-like nasal mucosa, or atrophic rhinitis, except merciful anosmia. Keyword beta, there is one expected MCQ on merciful anosmia. Merciful anosmia, patient himself is not getting any smell, is atrophic rhinitis, commonly seen in females. Absolutely true. Excessive crust formation and roomy nasal cavity. So let us on this platform revise two words: merciful anosmia, roomy cavity. Everything is atrophied, so patient will have roomy cavity. Modified Young's operation is a total closure of the nostril, not at all. It is modified. Not Young's operation is complete closure. Modified is partial closure, beta. It is not complete. It is partial. It is partial, not complete. Clear? It is we are leaving 3 mm opening. Examiner can ask you which solution we are using. We are using alkaline solution to clean the nasal cavity. To clean the nasal cavity, we are using alkaline solution. Done. Coming to the next one, a radiological presence of which of the following sinus appear last in the human being? So beta, what is the important table we have discussed? Maxillary, ethmoid, they are present at birth. We have learned this in the class. They are present at birth. At what age they are visible on the X-ray? 4 months, and this is 1 year. This is 1 year. Am I understandable? Frontal sinus develop by the age of 4 years, and X-ray it appears at age of 6 years. Sphenoid sinus, they develop around at 2 years, and X-ray appearance is around 4 years. Am I understandable? Again, let us revise. Maxillary, X-ray appearance 4 months, ethmoid 1 year, frontal 6 year, and sphenoid 4 year. So here I am asking you which is the last sinus to appear on the X-ray. Is will be your frontal sinus around 6 year. Around 6 year. Clear? Done. This is frontal sinus. Right answer will be frontal. Coming to the next one, a 75-year-old patient, carcinoma, CA larynx, where everyone on ENT notebook on the first page you should write CA larynx. MCQ have to be there. 75-year-old patient, T4N0M0 carcinoma lading undergo total angiectomy. He has permanent tracheostomy. Can you appreciate this is permanent tracheostomy? Following the surgery, he's using some device. He's keeping something on the neck for what? For vocal rehabilitation. What is this known as? This is electrolarynx. Always make a concept, beta. This is known as electrolarynx. Is it Blom-Singer prosthesis? No. Blom-Singer prosthesis or Penji voice button, these are options which are on the posterior wall. If I show you something on the posterior wall of trachea, what I have inserted between trachea and esophagus, that is tracheoesophageal prosthesis. But I'm showing you something on the neck. When I'm showing you something on the neck, that is electrolarynx. What is the best method? Best method is Blom-Singer tracheopengy voice button tracheoesophageal prosthesis. But at this year, I'm expecting one question. They can show you this slide. They can ask you, they will show you the same slide and they will ask you which surgery is being done in the patient. So just remember, we are putting a permanent tracheostomy tube, permanent, and patient is keeping something, so he must have some total laryngectomy done. So which surgery is being done in this patient? Total laryngectomy. Coming to the, I hope you are getting all the important points. Question number 8, anatomy of larynx. I don't know, I'm observing this for the last 20 years. Your examiner have a special love for anatomy of larynx. MCQ have to be there. You can write the date of the exam here. Cricothyroid muscle lie outside the larynx. Cricothyroid. Which of the following is not true? Cricoid and thyroid. This is somewhere here, outside the larynx. Sensory supply of infraglottic nerve is internal laryngeal nerve. Absolutely big blunder. I'm asking you, not true. So this is not a true statement. This is a false statement. Area below the vocal cord, infraglottis, is always recurrent laryngeal nerve. Area above is, let us revise in a fast mode, beta. All muscles supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external branch. Area below the vocal cord, recurrent laryngeal nerve. Area above the vocal cord, internal. So this is my false statement. Which of the following is not true? Not true is a B option, is not true. Let us read the other option. Interarachnoid muscle is unpaired. They have asked you many times which of the following is a unpaired muscle. So go for interarachnoid. Subglottic is the narrowest part of the infant larynx. Absolutely true. Adult, it is glottic area. Infant, it is subglottic area. Infant, it is subglottic area. Done. So B option is a false statement. Coming to the next one. Which of the following cranial nerve cuff reflex is there? Oh, very important point, beta. Ear wax is there. I'm cleaning the ear wax. I will touch which part? You should be master of basic line diagram of my external auditory canal. If this is a line diagram of external auditory canal, posterior superior is supplied by 7th nerve, anterior superior is by 5th nerve, and anterior inferior is 10th nerve, and here is C2, C3 fibers. So whenever the facial palsy is there is a loss of sensation in this area, they can ask you Hitzel-Berger sign. This is Hitzel-Berger sign. They can ask you trigeminal neuralgia. Where is the maximum pain? They can ask you cuff reflux. If I am the examiner, I will ask you which area, if you touch, will be having cuff reflux. Anterior inferior. This is anterior superior. This is anterior inferior. This is posterior superior, posterior inferior. Posterior superior, posterior inferior. So these are the important nerves responsible for external auditory canal. Clear? Coming to the next one. 58-year-old patient with fever, sore throat, difficulty to swallow. His radiograph is shown. What is the likely diagnosis? So beta, you tell me what I am showing you. I am showing you a typical thumbprint sign, epiglottitis. Stipple sign, if they show you something like this, is a stipple sign, that is your laryngotracheobronchitis. And if the examiner show you this one, this is typical thumb sign. Thumb sign. Am I understandable? What is this? Beauty of this topic, beauty of this topic. This is a emergency. This is a emergency. Patient is an emergency patient. We have to treat. We go with the IV antibiotics, but we have to admit the patient in ICU and then we treat the patient. Clear? So this is purely epiglottitis. Coming to the next one. Coming to the next one, perilymph is a fluid between membrane and bony. Very simple, easy MCQ. Perilymph is rich in which of the following iron? So beta, this is my membranous part, this is my bony part. What is inside the membranous part? If I go inside the membranous part, we are having endolymph. This here is my endolymph. What is there in the bony segment? It is perilymph. Endolymph, high concentration of potassium, and perilymph, high concentration of sodium. So I'm asking you about perilymph. So option A will be the best choice in the MCQ. Endolymph, high concentration of potassium. So if the examiner asks you about endolymph, it is potassium. Done. Coming to the next one, a 37-year-old COVID patient with painful swelling in the retroorbital area of the nose, 5 days. From the first day of presentation, he was unable to open his left eye vision. Left reflex was lost. Patient is giving a typical history. Then examiner is giving you a clue. What is the rule we have learned? You tell me what rule we have learned in the classroom. Any image-based MCQ. We will see the image first. This the first slide. Diabetic patient, your post-COVID patient. Diabetes mentioned. Necrosis over the ear. If there is a necrosis over the ear, I will go for malignant otitis externa. We have learned it is mucormycosis. And what is the drug of choice? You tell me. Amphotericin B. Which is a better word? Liposomal amphotericin B is the drug of choice. Liposomal amphotericin B is the drug of choice. This patient have a special love for blood vessels. Always remember, this patient have a special love for blood vessels. Done. So therefore, this organism will be having special love. So no bleeding, no pain will be there. No bleeding, no pain in this patient. Coming to the next one, a old MCQ of NEET MCQ examination, which can be a potential question for your exam. A patient with emergency CSOM history, they have shown you some CT examination. What I'm diagnosis, temporal lobe abscess. Most common intracranial complication. Always remember, most common intracranial complication is here meningitis. Second most common, brain abscess. And which lobe is commonly involved? Temporal lobe. Temporal lobe is commonly involved. Which is second most common involvement? Second most common is here cerebellum. Just remember this points. What I'm asking you is your temporal lobe. What is the treatment of choice we will going for? We have to go for neural intervention, neurosurgical intervention. With we will go for ear, we'll go for modified radical mastectomy. And then coming to the next one, all of the following statement are true about temporal bone fracture except beta skull fracture, one of the important topic. So let us read in a nice way. I will explain you. If the trauma is coming from behind, it is transverse fracture. If trauma is coming from behind, it is transverse fracture. If the trauma is coming from anterior superior, it is longitudinal fracture. This is longitudinal fracture. This is transverse fracture. Transverse fracture are more commonly associated with the facial palsy. Very true statement. If somebody hit you from behind in the midline, the inner ear damage, the pons damage, so there is a high risk of facial nerve palsy. Ear bleeding is suggestive of longitudinal feature, longitudinal fracture. External ear damage, middle ear damage. True statement. CSF arteria is more common in transverse fracture. Not at all. If there is a trauma in the middle ear, external ear, CSF will be in longitudinal, not in transverse. Longitudinal fracture commonly cause conductive deafness. Absolutely true. External ear, middle ear damage. If external ear, middle ear damage, so it will be conductive deafness. True statement. A, B, D are true and C is a false statement. I try my best to give you all the important topics of upcoming examination. All of the following. Last one, malignant otitis externa. MCQ have to be there. You can write the date of the examination. MCQ have to be there. All of the following are true except false statement. I have to such make a habit of writing alphabet T or F beta. So I want to choose the false statement. Skull base osteomyelitis is a true statement. Technetium 99 scan is a prognostic marker. Not at all. What we have learned in the class, you tell me, we have revised it multiple times. And you people have given a nice feedback when we were learning malignant otitis externa. It is for diagnosis. Technetium 99 scan diagnosis. Gallium scan for prognosis. If patient is very poor, he can't afford all these scan. So what is the other thing we can do? In medical college, we can use ESR. Yes, true statement. After how many weeks ESR comes down? After 2 weeks, ESR comes down. Facial nerve is commonly now malignant otitis externa. What is the presentation? Presentation is ear discharge with granulation with facial nerve palsy. true statement. The answer will be option B. Option B is a false statement. Treatment. M for malignant, M for medical treatment. Beta. Always remember, treatment of choice is medical. Pseudomonas third generation cephalosporin is the drug of choice in this patient. I hope you're getting the message. So this completes your ENT segment. Beta. All the students, I hope you must have enjoyed. I highlight my all the important topic. I tried my best to give you the important topics which you should revise before the examination. Any query, you what's a message in the Telegram group, or you can inbox me on the Insta. Thanks a lot for listening to me. Best wishes. And what is mission? Mission is you have promised me 200 beta. We have to cross 200 this time. Best wishes.